Two physicians, one conversation, doctors on doctors.
Welcome to Doctors on Doctors, a podcast where real conversation in medicine takes center stage. I'm Dana Subah.
And I'm Farah Shaheen, and we'll be your moderators for today's episode.
This podcast is all about bringing doctors together to talk openly, honestly, and unfiltered about the parts of medicine that don't always make it to the intellectuals or textbooks.
Each episode is built around three main segments: personal stories, case-based discussions, and finally, real student questions answered by real doctors. And in today's episode, we're combining both case discussions and match dilemmas, giving you a deeper look into the critical decisions and moments behind the match process.
We're thrilled to be joined by two amazing guests who've recently matched and are here to share their journeys with us.
Joining us is Dr. Farah, a graduate of the University of Jordan, who matched into internal medicine at the University of Florida. Congratulations, Farah.
Thank you. And we also have Dr. Narges, a graduate of University of Jordan, who matched into general surgery at the University of Illinois. Huge congrats to you too.
Thank you. So, Dr. Farah, we would like to know a bit more about you. If you could give us a brief introduction about yourself.
Sure. So, hello everyone. I'm really happy to be here. My name is Farah Khreisat. I graduated from the University of Jordan in 2022. After that, I completed a one-year internship in Jordan, and then I decided to pursue my passion for teaching. So I worked as a teaching assistant at the university that I graduated from, the University of Jordan, and then I decided to work as a general practitioner at Jordan's largest diabetes and endocrinology center, during which I was applying for residency, which is recently I matched for internal medicine residency at the University of Florida, and I'm happy to be here to answer all your questions.
Thank you so much for joining us today, Dr. Farah, and again, congratulations for matching.
Thank you. Okay, Dr. Narges, can you tell us a little bit about yourself before we start?
Okay, so hi everyone. Thank you for having me. My name is Narges Sweis, and I graduated from the University of Jordan in 2023, and I didn't do any internship. I flew directly to the States and pursued a postdoctoral fellowship in colorectal surgery at the University of Illinois at Chicago, where I matched, and I'm still doing that job, and I'm here.
Congratulations, Dr. Narges. Thank you so much for being here.
We're so excited to have both of you here. Let's get into our first segment, Doctor's Life. This is a dialogue-style exchange between Dr. Narges and Dr. Farah, where they take turns asking each other questions.
Hi, Farah. I'm going to ask you the first question. Was there a specific moment in your medical journey that changed the way you see medicine or yourself as a doctor?
Okay, so absolutely. I think one of the biggest, let's say, challenges I had throughout, not just my medical journey, but my life, is something that happened at the beginning of my senior year. So in September 2021, oh my God, it's not easy to talk about it. So my mother got diagnosed with cancer at the beginning of my senior year. Suddenly, my life changed. So my life shifted from being a student who's worried about, let's say, research deadlines and exams to someone who is forced to be the caregiver of the person who has always cared for me, which is my mother. Suddenly, my life shifted and everything is blurry afterwards. I remember being a 21-year-old who has not yet graduated medical school, who's contacting doctors from the US and Jordan, asking about treatment plans, asking what should I do, asking what's the best option, if I should treat her in Jordan, if I should let her fly outside because the cancer that she had was rare. So it was a very difficult journey, especially at the end of medical school. You know, at senior year, you start to think about what you want to do after medical school. And at that moment, I felt like, you know, my medical journey was over. I didn't know what to do. Because I was a first generational doctor, I was the bridge between my family and her care team. So I was responsible for explaining the medical terms to them and sometimes reading articles saying bad prognosis about my mother. So that was not easy for me. And I remember having to deliver hopeful news one day and disappointing news the next. So it was an emotional roller coaster throughout my senior year. And I remember having to postpone my pediatrics and surgery OSCEs until my mother stabilized. And then after that, after her condition was stable enough, I was able to take my surgery and pediatrics OSCEs with my gynecology OSCE, which was a just devastating week for me, you know. So let me say that throughout this journey, I experienced being on the other spectrum of medicine. I experienced being the family of, let's say, the patient. I've always been the medical student, the doctor. Now I know what patients feel. Now I know that we need physicians that treat the patient as a whole and treat you with respect, not just telling you, oh, you have this and go, you know? And throughout this journey, throughout this year, I have let go of my dream of graduating as one of the top 10 in my medical school class because I felt like that was not possible. But then a year later, I was celebrated as one of the top 10 in my medical school class. And as I walked that stage, I looked in the crowd and I saw my mother. To me, that was my I made it moment. It was not about achievement itself. It was about how difficult it was for me to achieve this throughout this year. And seeing my mother healthy, happy, clapping for me in the crowd was something I could have never imagined throughout this year. So I think throughout this journey for me, I discovered that no matter how dark the times are, I can definitely shine through. And this had made me a very strong person and a different doctor. Now I know what kind of doctor I want to be and what kind of doctor I will be with my patients. I will take my experience with my mother with every patient encounter and every case I see.
Wow, that was such an emotional response. Thank you so much. I can't believe the journey you've been through. It was so difficult. It must have been so difficult, but mashallah, yani, you're such a strong medical student and a strong medical doctor for going through all of that and succeeding after all of that. Thank you so much, doctor. Can we go on to the next question?
So, Dr. Narges, if you could go back in time to any moment throughout your journey, either to change something or to relive it again, what would that moment be?
My medical journey was very basic. I was like from university to the house, from the house to the university, and that was about it. But I would really like to experience my 5th year again. It was very enjoyable. It was when I actually decided that I want to pursue surgery as a career choice. And students don't usually give our clinical years their what they're worth. And we take things for granted. Like even Farah like shined a light on that in the first question. Like we never value a moment until it becomes memory. And now I'm looking back at my like medical years. I'm like, no responsibilities, nothing. Now I live alone. I take care of myself, my taxes, everything. Like I am sit البيت of my own house and I don't like it. Like I want to go back and be spoiled, have no worries, nothing. So I wouldn't change anything in my medical from my medical years, but I would really like to live the funnest year of my life, which was the 5th year.
Honestly, Dr. Narges, I really relate to that. I feel like medical school is a long 6 years, and we can get lost in the chaos of it, the stress, the books, the papers, the exams, the externals, just all of it. And I feel like, yeah, it's really important to appreciate the good days while they're here, because one day we will grow up and we will eventually leave Jordan or maybe stay in it, but carry different responsibilities and actually live the adult doctor life. So yeah.
The responsibilities only increase with time. They never.
Obviously, yeah.
So, Farah, what's the hardest decision you've had to make as a doctor, and how did it affect you?
Yeah, I think this is a follow-up question to my first one. The hardest decision I had to make was actually deciding to pursue the path of going to do residency in the US. I always wanted that, but after my mom was diagnosed with cancer and I was her caregiver, I always thought it's selfish to do so. Because, my mother needs me, my family needs me. I don't know how I'm going to do that. And, everyone knows the path is not easy, even if you don't have circumstances. Like you have to do step 1, step 2, OET. You have to do research. You have to be fully focused in this pathway in order to succeed, let alone having, being the caregiver for the most important person in your life, that is your mother. So I remember I made my decision during my elective rotation at the University of Florida. I did an elective rotation at the University of Florida, which is the place that I matched at in June and July 2023. During that time, my mom was doing fine when I traveled. However, during my elective rotation, I was following her, let's say, images and her tests on my phone because I have an application for that. And I discovered that she had a relapse while I was in the US. So I remember it was like going all back again into the first time I knew she was diagnosed. I didn't know what to do. I was blaming myself. I was like, I shouldn't have traveled. I shouldn't have left her alone. I shouldn't be too selfish to do that. However, God is great, and God sent me a sign. I remember I met a doctor there that I really admire. He was let's say, the chief, or let's say the program director of a program there. And he was telling us his story, basically. So he was saying that when he was also an IMG, and when he came to the US, his father was sick. It felt like it was identical to my story. So I was like, wow, that's unbelievable. So I asked him, like, how did you do that? And I told him my story. And he told me something I never forgot, which helped me to go through this pathway. He told me, Farah, you should just work hard. And if it's meant to be, God will make the pathway easy. And you will be able to do that, and you will be able to match. If it's not meant to be and it's not good for you or your family, you will not be able to match. So just work hard. And he told me that when he came to the US, he was able to offer his father treatment options that he wouldn't be able to offer if he was in his home country. So he gave me hope for that. I remember going back to Jordan, doing step 1 and step 2 in 1 year, and then applying to the match. And my mother's health was better than before. So it was like all the pieces fell into the same puzzle. And it was like God told me that this is the path for me. And I'm really happy I didn't give up, because I had many, many, many moments where I said, I shouldn't be doing that. And I was feeling guilty for like following my dreams, you know? I even remember like 1 week before my step 1 exam, which was like February 2024, my mom was in the ER because of some like stomach issues. And I was like revising Anki cards in the ER, you know? So in these moments, I felt like I should give up, but I'm really happy I didn't. And I want to say to everyone that, you know, from the outside, many of the people who know me right now maybe don't know my story, and maybe will be shocked because I look like the person who has it all. And many people tell me that, wow, how did you achieve that? Wow, you must be so happy. I am happy, you know, but I want to say that not everything is as it seems, and people go through a lot to achieve their dreams, and you should go behind your dreams no matter what. And if it is meant to be, it will happen no matter what. So I'm really happy I followed my dreams, and now I'm going to my dream hospital, my dream program, and I hope everyone achieves their dreams no matter what.
Thank you, Dr. Farah. Honestly, you make it really seem like hard work really achieves any dream that you have. As long as you put the work into it, you can definitely achieve it. Can we move on to the next question, please?
Okay, Dr. Narges, if you had to explain why you stayed in medicine despite all the challenges that you've been through, what would you say?
I'm gonna be honest, I've never thought of dropping out during my medical years, but I did think that, do I want to pursue residency after what I've been through here? Because everything is just so difficult, and I never knew anybody who matched in surgery personally. So it was just like on my own, it was like on my own trip, and I didn't know what I'm gonna do. And everything was just not falling into place. And I was like, it's not meant to be. But the honest answer is that I've already spent 8 years of my life in that. And everything is difficult in life. مفيش إشي سهل. Nothing is easy. Life is not bubbly and pink everywhere. And other specialties are going to be just as difficult. So if I passed 8 years of my life with what I did, I think I'm going to do like an extra 5 or 6, maybe 7 more. Like it's not going to be that difficult. So the end answer for me is that I've already spent 8 years of that, and I didn't want to redo something else.
You know, Narges, and I know Narges personally, we're really good friends. I remember when you told us that you want to pursue a surgery residency, many people told you like, oh, let that dream go. You know, it's not easy for us as IMG. You should like pursue something like, you know, pediatrics or internal medicine or something else. I remember you even liked urology back then. You were thinking like surgery or urology. Yeah, and everyone was like, oh, you should let that go. And I'm really, really happy to find out that you did not let that dream go. And you finally,
I was this close of letting go. I'm so glad I didn't because, like, if it's you just said it, نصيبك راح يصيبك, right?
So true. Yeah, so true.
It's my turn. Let me ask you a question.
Yeah.
What's one thing you wish you knew before starting your medical career, and how would that knowledge have changed your path?
Oh my God. There are many things. If I start now, it's not going to end. However, the most important thing that I want to say is that, and something that really changed my life, is take every opportunity that is offered for you, even if you don't feel ready for it, even if you feel like this is not the right time. The right time will never come. You will never be 100% ready for any opportunity. So if you always tell yourself, I used to be that person in my first like 4 or 5 years of med school. I was like, no, I can't do that. I'm not ready. I can't join this research project. They will think I'm stupid. I can't do research. I don't know how to do anything. But then I don't know, something shifted in me. It was like, so what? Let me be stupid. Let me learn. You know, what's the worst that could happen? So my advice is take every opportunity. And I'm a firm believer of the butterfly effect, which is basically when something small happens leads to big changes. I will tell you a story that led me to my match eventually. And people tell me, do you have connections? How did you make that? How did you do that? Let me tell you something. I remember during my final exams in my senior year, so I was like 2 weeks from graduation. It was really stressful. Everyone knows how is it like with OSCEs, with exams. It is very stressful. There was a Jordanian doctor who works in the US. He posted on a group for us. He was like, I'm coming to Jordan to do a boot camp to teach like residents, and I want students to help me organize this boot camp as volunteers. And from this boot camp, I will have like 2 research papers that we will publish later on. So when I saw it, the first thought was like, oh, Farah, you have so much on your plate. You're currently doing exams. This is not the right time. You shouldn't do it. And then I was like, so what? What's the worst that could happen? So I remember opening the form, and the form was very long. It was like really detailed, and it was like they needed a motivational letter. Because I was so overwhelmed, I didn't even like care to write a polished one. I just wrote one on the spot in the form. Like I didn't even write it in the notes and then copy and pasted it. No, I wrote it on the spot in the form, and I don't even remember what I wrote, and I submitted it, and I forgot about it. And then after that, like 2 or 3 weeks later, after we finished, like after I was recovering from my exams, I suddenly get added on WhatsApp to a group called Bootcamp 2022. I remember my first thought was like, what? I just finished my exams. What is that? Like, I didn't even remember that I applied, you know? Turns out they posted 1 week ago, they accepted names, and I was accepted with 2 others out of like 100 applications. So it was like, what? I was shocked. So after that, we started working and organizing that bootcamp. Fast forward, 3 months later, we wrote 2 research abstracts, and they were accepted for presentation at the American Thoracic Society Conference in 2023. That was my first time going to the US. I didn't have the time to do electives during my senior year because of visa issues. So, and then I thought to myself, I was like, since I'm already going to the US, why don't I try to do like a rotation after the conference? So I texted the doctor that I worked with, the same Jordanian doctor that I worked with on the bootcamp. I told him this and that. I remember his first like reaction was, no, the conference was in May. And his first reply was, does June suit you? He only texted me this. I was like, oh my God, of course, this is the perfect month because, you know, the conference is in May and I don't want to go back to Jordan and then go back to the US. No, I want to go like immediately. So it was perfect. So that's what I did. I presented at the conference. I did my elective rotation 2 months at the University of Florida, went back home, did the steps, applied to the match, and then initially I matched at the University of Florida. Now, just imagine I didn't apply to this opportunity. Yeah. Where would I be now? Yeah. That's why I want to tell you. I was really afraid. I was thinking to myself, I was like, oh my God, thank God, alhamdulillah, I applied to this opportunity. It changed my life. You know how small of a project it was, but it did change my life. That's why I want to tell everyone, take every opportunity. Every opportunity, you don't know what doors it will open for you. Don't think you are not good enough, because if God let that opportunity come in front of your way at that time, then you're ready for it. Don't say no.
Honestly, that's great advice because I feel like as medical students, we compare ourselves a lot to those around us. And you see these students that are like 20 papers, 30 papers, and they're in like their second year. And you're like, okay, I haven't started on my first paper. How am I going to get in? If I do get in, I won't be any help to them. Like I can't help them. So yeah, thank you for that advice. It's honestly really needed for most medical students.
And you're like standing there and like, what is a meta-analysis? And they're like, exactly.
Yeah.
You're like, it's like Mr. Please. Yeah, we've all been through that. Don't worry.
Yeah. I used to say knock on all doors
Yes.
because even even the story of how I got my elective, how I got my research position is just crazy. And it all led to one place and it all led to me matching in the same place. So it's just knock on all doors. That's what I can say.
Yeah, that's great. All right, so can we move on to the next question?
So, Dr. Narges, if you could write a letter to your younger self before medical school, what would it be?
I would start with we made it. I've always wanted to become a doctor, especially like a surgeon growing up. And I would also like to advise that to be sahalik. Like I didn't like it was just
You put too much pressure on yourself.
yes, I was too dedicated for this thing. أثمرت at the end, but
We felt burnout before.
yes, like I said before, we forget to live while
Yes.
pursuing our dreams, and we should really focus on I saw something that I once read and I really liked, and I would also tell it to my younger self. I would say, you have a to-do list, things to take care of. Don't forget to put yourself in that list. Take care of yourself. Don't always say, once I finish this exam, I'll go out and I'll have fun. Once I finish this exam, I'll go spoil myself, dye my hair, do this and that. No, do it now, because tomorrow might not come. And maybe when tomorrow comes, you might not be interested in doing that thing. So just enjoy your life while you can. That advice I'm going to give to my younger self.
That's amazing. And by the way, amazing hair color. I love it. Thank you.
I like to say, yeah, I should my own house.
I love it.
Dr. Narges, I would like to say something. I have a tiny question. Do you think that you would be in the same place that you are in today if you hadn't been so harsh on yourself? Because some might argue that, well, we have to be harsh on ourselves. We have to live a strict lifestyle. We have to give our all every single day and then not get tired of it and not feel weak. You know what I mean? To eventually one day reach big places like you have reached today. So do you think that it's essential, or do you think that no, we can have a balance? The balance does exist.
Balance does exist, definitely. Sometimes if you put too much pressure on yourself, you collapse. And you don't want to we don't know our threshold, so we don't want to press too hard on ourselves to a point when we don't know what's going to happen.
Yeah.
So balance is always good in everything in life.
Yes.
And I would also give you this advice that time management solves everything. So like we have how many hours a week? We have 24 hours a day times 7. Can't you give 3-4 hours a day for school? It's going to be more than enough. Can't you give 2 or 3 hours for yourself? More than enough too. We usually forget to do that. And one of the reasons is that social media takes a lot of our time. We get those little dopamine surges from scrolling through Instagram, laughing on the reels, and then we look at the time. It's like, oh, it's bedtime now.
Yeah.
At the same time, you could just prioritize yourself.
Oh, yeah, 1,000%. Yeah. Okay, so moving on to our next question.
Has a patient ever taught you something that changed how you practice medicine?
Yes, definitely. Whenever someone asks me, I remember during the match process, many interviewers asked me about interesting patient encounters, and I always told them this story. So during my elective rotation, I was on the cardiology service, mainly the heart transplant service. So I remember I was taking care throughout my rotation. It was like 2 weeks. So I remember I was taking care of a man in his mid-40s. So he's not really old, And he had a congenital condition in his heart where he has been waiting on the heart transplant list for about let's say 15 years. Okay. Because at the beginning, in the first few years of his life, things were stable. He was able to live with the heart he had. However, things then deteriorated, and then he kept coming in and out of the hospital, having sometimes, balloon pumps, sometimes impellas, things like that. And then during my rotation, he was admitted because he had a decompensation and he was upgraded from level 3 to level 2 on the heart transplant list. So he needed a heart. So I remember he used to be with his wife all the time. And I remember when I was pre-rounding on him every morning before the rounds, asking him how he's doing. I remember asking him one day, like, I'm really amazed by your optimism. How are you like holding up so strong? Because it's not easy. You know, you're waiting, let's say, for a heart. It's not easy. It's not like you're like waiting for a liver or a kidney, you know? And I remember him telling me a sentence that I will never forget, and I want the audience to hear it too. He said, I did many beautiful things in my life throughout those 20 years with a sick heart. Imagine what I can do with a good one. That's why I'm holding on to this thought. I believe that I live an amazing life with that sick heart of mine. But that's why I believe that I can do so many amazing things with my good heart that I'm waiting for. So it hit me. It was like, this person, even he has a sick heart, he has lived a very beautiful life, done very beautiful things, and he didn't take life for granted. While us, especially in the medical field, we feel like we take everything for granted, honestly. We always feel like, oh, I have a research deadline. Oh, I have an exam. I'm really anxious. We forget that we are healthy. We can live life completely. And he taught me to put my heart into everything that I want to do. That's why after that encounter, I remember whenever I get tired, whenever I get frustrated with the medical community or with, let's say, treating patients, I remember his encounter and I'm like, if that person who was waiting at the heart transplant just said that, then I, a healthy person, I should live life to the fullest. And I advise everyone to do so, especially in our field, like Narges said, you should, work so hard, not only for medicine, but also to live your life.
Yeah, perfect. Thank you.
That's a beautiful answer.
It is. It really is.
So, Dr. Narges, how do you define success as a doctor?
I would summarize it in 3 words: make an impact. So for me, success is about leaving people and places better than you found them, no matter the scale. So it's all about baby steps. Start small and then grow bigger. For example, it could be on a personal level, like having a patient say thank you to you sincerely and say, you saved my life. Or it can be on a professional level, like, I don't know, guys, if you heard of Dr. Yaman Tel. I'm very inspired by this doctor because you know that the #1 destination for hair transplant is Turkey, and the #1 destination in the world for hydraulic implants for erectile dysfunction is Jordan now. Yeah. So this is excellent that one of our doctors, a Jordanian doctor, was able to make that impact. That's like also a definition of success. So whether it's on a personal level or a professional level, make an impact. #1 destination for hair transplant is Turkey, and the #1 destination in the world for hydraulic implants for erectile dysfunction is Jordan now. Yeah. So this is excellent that one of our doctors, a Jordanian doctor, was able to make that impact. That's like also a definition of success. So whether it's on a personal level or a professional level, make an impact.
I love it.
I do as well. Thank you. That's honestly really inspiring. And we should always try to set the standard higher for ourselves and for our patients.
So that will be the end of our first segment. Thank you guys so much for your beautiful answers. So our second segment is going to be match dilemmas and case discussion. So challenges or tough decisions we would like to hear about challenges or tough decisions you have faced during the residency match process. And we would like to hear about one medical case that stumped you, a case where the diagnosis wasn't obvious. Walk us through your thought process, please, differentials, and how you solved it.
Okay, I have many dilemmas. So I'm gonna start with the first one, which was how many programs should I apply to? Surgery is very different than internal medicine in terms of how many programs are actually there. So for medicine, I don't know, like 500, 600, I think, like in total.
Yeah, never, much more, I think.
Oh, for Gen Star, just like 320.
Oh yeah, it's limited.
Yeah, and so one of my biggest challenges was figuring out how many programs to apply to and which ones to prioritize. I didn't personally know anyone who matched into general surgery, so I had no real guidance. I kept hearing numbers from American students like apply to 30. I'm like, no, please. 30 does not do me justice. I'm an international graduate.
Yes.
The Jordanians used to say apply to 100. Some of the people would say if you have money, apply to all 320. but that's not actually a valid option. It's going to be like 10,000
Yeah.
dinars in cost, and that's a bit too much. So there was no clear consensus on what I'm going to have to do, and my scores were not the highest, so I was not going to compete with the best of the best in Jordan. So I didn't really know if I should apply to programs who have a score limit, like 260, for example. Surgery is very different from internal medicine, like I said, especially regarding how and when interviews are also sent. And I didn't know if I was being ghosted in October, November. I got my interviews in December, and I thought that the timeline was just, I thought I was being ghosted. Apparently the timeline is just slower. I ended up applying to 78 programs across the country with a mix of academic and safety net hospitals, like community hospitals. I made some mistakes there. Like if time went back, I'm going to change what I applied to and why did I apply to those programs anyway. I'm going to always say like aim for the stars, but everybody should know their place and their worth. Like me, I'm not going to apply to Hopkins. I'm not going to apply to Harvard. Don't waste your money and apply to those programs. And at the same time, for surgery, it's different than internal medicine also in terms of the positions that they offer. For surgery, they have preliminary positions and categorical positions. For example, I'm going to say UIC has a total of 8 spots categorical and 8 spots preliminary. And my other dilemma comes here is that I never knew that surgery is kept at 7 years maximum of training. So if you imagine to a preliminary position, that means only you got a 1-year position. You did not get a full 5 years training. So you're not for granted. You have to apply again. And if you applied again and you didn't make it, you lost a year. Or maybe another year because you ended up soaping. And it was just like, that's where I was like, oh, I should have applied to a second specialty. I should have, so double applied to internal medicine, maybe family medicine, so I just don't end up wasting a year. Going back to preliminary interviews and preliminary positions, these 8 preliminary positions at UIC go away. They find other specialties. So from the 16 spots in the first year, you jump to 8 spots in the second year. So I was like, what have I done with myself?
Yeah.
No, I'm not going to do that. So I would say for surgery, it's very difficult to apply to get a categorical spot. So if you got a preliminary spot, now you got your foot in the door and you're going to get letters from attendings who watched you train as a surgeon. So you're now at the same level like an American graduate. So then it's all on you, whether you match again or not. Those are like the biggest dilemmas in terms of general surgery and matching, in my opinion. And if I can speak about it till tomorrow, I will never fill in. So I'm trying to be like very.
These decisions are really difficult, and the match process itself comes with many stories that we will tell, I think, for the rest of our lives. I think when you talked about that, something sparked in my mind, which was something that was new this year, the signals. Especially in internal medicine, this year was the first year that we have 15 signals. So basically, you signal programs that you want them. This year, we had 15 signals for the first time, 3 gold signals and 12 silver signals. So it was the first time. No one knew how to handle that. People said, like, if you silver signal a program, they will know that you did not put them one of the top 3 because you did not put them as gold. So they will not rank you high. And that was really nerve-wracking because you were like, I like this program so much, but I can't, signal all of them gold. And if time goes back, as Narges said, for me, I wanted to apply for less than like 100 programs because I felt like that was enough and I had really good credentials. However, the people around you are like, oh no, you're an IMG. You should apply for like more than 100 programs and you're not going to match if you do that. So I felt in that trap and I applied for like 130 programs. And I honestly regret that because that was too much money. If time goes back, I would apply for like 20 or 30 programs above my signals because most of my interviews came from my signals. And again, in the way you choose signals, that was really difficult and a dilemma, as Narges just said. However, in the signals, some people used to say, oh, you should signal programs that you don't know anyone at and that you did not do rotations at because you will increase your chances. And the programs that you know people at will already send you interviews. That's not how it works. For me, the perfect thing is to combine all of the circumstances, to combine all of the good circumstances in one program. For example, if you did your rotation at a program, you should signal it. And you should talk to people who you know at that program. And you should do geographical preference. You should try to achieve all of the perfect circumstances for you to match at that program. Not say, oh, I already did my rotation at that program. I do not have to signal it. For example, me at the University of Florida, I give it a gold signal because I wanted them to know that I went there. I want them, and I want them to want me. And now, fast forward, I know that one of the associate PDs had a meeting, and she said, we care about signals so much. And that's why I remember my first interview of the whole season in early October was from the University of Florida. So don't listen to people who tell you, oh, signal programs, for example, let's say Harvard, and you don't even know anyone at it because, it will send you signal. No, that's not how it works. You should try to put all of your efforts at the program that you really want in all terms, like signals, letters of recommendation, connections, all things in order to match. So this is one of the most important things. And another dilemma is something I think Narges didn't have to put up with since she was in the US, is having the time difference in terms of interviews and meetings. Oh my God, I can talk about that forever. Because I was working through the math process, I had my work from 6:30 a.m. to 4 p.m. And I remember most of the meet and greets, they were at nighttime in the US. So they were 4 or 5 a.m. in Jordan. So I remember having to, and my work wasn't really flexible with that. I remember having to do a meet and greet at 4 a.m. And then after that, it finishes at 5 a.m. And then after that, I have to go to go out from the house at 6 a.m. And then in the second day, when I go back home at 4 p.m., I have an interview at 7 p.m. So I had many weeks of no sleep, and I think as international medical graduates doing your interviews in Jordan, you should keep it in mind because it is something important to plan ahead of time to be able to plan, your first of all, the timing of your meet and greets and also the timing of your interviews. If you can separate them, that would be better so you can have at least some sleep.
And one other advice I'm gonna say, following up on what Farah said, is that don't listen to people. People are just gonna talk and just gonna give advices, and they don't really have a basis for it. From my experience, it's really program director specific, not even program specific. So the program directors at my institution changed very frequently, and everybody has a way of choosing applicants. My boss, for example, he's the chief of colorectal surgery. He was program director last year. He would say, I don't care about signaling, for example. I don't really mind. The program director this year, I thought, also Farah talked about this, I said, me working at UIC is a signal by itself. I'm not going to signal them. So the program director told my boss, I don't know why your research person did not even signal us. He doesn't really care about getting an interview at our place.
Oh my God.
So sometimes it's just, you never know what you're going to do. Yeah. So you have to try and make mistakes. I made a lot of mistakes, and if time goes back, I'm just going to now know what I'm going to do because it just really differs.
Yeah. And I want to say in Jordanian words, there's a lot of habit in this process.
Yeah.
When you ask people, they're going to say, I don't want to say the word, but they're going to say so many weird stuff. And they're going to say, things that don't make sense. Just eventually, ask people. It's okay to ask people, but who to ask, people who are really in the process. And also, even sometimes, I asked someone who was a program director. And she was I asked her, I remember before, I applied, I took step 2, just before the match, in August. And I asked her, and she was you're so late. You will not be able to apply to this match cycle. She was and she was the program director. She was I think, Farah, it's not the right time for you to apply for this match. People are already preparing for the interviews, and you have not done step 2 yet. And I was I'm not gonna do what she said. I'm doing what I want. I'm going to do very good in my interviews. I know what I'm going to do. And please, so know who to listen to. And please do eventually what's your mind and what makes sense for you. Because many people are going to say some things that don't make sense, honestly.
100%.
100%. Yeah. And so about the medical cases, we'd love to hear about them. If you guys would like to start talking about that as well.
I personally never engaged in any patient interaction. Like I never cared for a patient myself because I've never even done imtiaz. But since I work in research right now, I kind of have patient interactions in terms of screening patients and going to clinic for some randomized control trials. So I would like to say a case that I was there and the diagnosis was difficult, and I'm going to say a take-home message after the end because it's a very important topic that's sometimes missed. So my case is, like I said, when I was working on a randomized control trial, background about it, it was comparing dearterialization for hemorrhoids versus hemorrhoidectomy. And I was screening every clinic patient who came in with the symptom of bright red blood per rectum. So this 27-year-old male patient, he was of Mexican origin, came into with the classic symptoms, just blood on the tissue when wiping. So the attending surgeon was like, it's a hemorrhoid clinic. Let's just like chop, finish everything fast. Take detailed history, of course. Nothing, no red flags. He was just blood on the tissue when wiping. Based on the history, anoscopy, physical exam, the obvious diagnosis was hemorrhoids. He also had he actually had grade 3 hemorrhoids, and he was scheduled for rubber band ligation. But during doing a digital rectal exam, it's a very traumatic experience, I would say, and it's very awkward. I was chatting with the patient just to ease the awkwardness of the situation. So I casually mentioned that, how are you doing these days? What are your plans? And he said, I'm very stressed because I'm getting married, and this stress is getting to me. I even lost 80 pounds. Oh, so they were like, how did you lose 80 pounds? You're 27. Like, did you do something? He's like, no, I think it's just the stress. So we're like, that's not there. Let's see you got going on. So yeah. We were like, but the DRE is just normal. We didn't feel any masses or anything. So we're like, listen, we have a rigid, a flexible sigmoidoscopy in the clinic. Let's look. So once we did the sigmoidoscopy and we saw a high rectal mass, and the bleeding was the source, there were hemorrhoids too, but there was other source of bleeding, which was the rectal mass. And biopsied, staging, whatever, he had stage 4 rectal cancer at 27. It was crazy because there were no other symptoms, no pain, no change in bowel habits, nothing. Just unexplained weight loss that came casually when chatting with the patient. So it's not because it's medically a special case. It just reminds us of how it is easy to miss early onset cancer, especially these days, because early onset cancer, not just with colorectal cancer, because I'm working with it, all types of cancers is on the rise because we are what we eat. And our food habits these days are just terrible. And because my research work is mainly on early onset colorectal cancer, and the treatment guidelines are all about, are all based on the nationwide studies of the United States, which are mainly about white people because they're 70-80% white people. And early onset rate, if we put the cutoff point at age 45, the early onset rate is 5.4% of people diagnosed with cancer present before the age of 45. And it's not worth it to do colonoscopies for them. But if you do a sub-analysis of country of origin, 15.6% of Mexicans present below the age of 45 with colon cancer. That's nearly 3 times as high as white people. It is not looked at because they are a minority, and compared to the high number of white people that the guidelines are made from, they usually get missed. And I also looked at other countries of origin regarding early onset cancer. Indians, Pakistanis, Koreans, also early onset rate is 15-point-something%, which is crazy. If we want to look at rectal cancer, South Americans, 20% of South Americans, let's say Colombia, Ecuador, those countries, they present before the age of 45. And we're not putting the cutoff point at 50. We're putting it at 45. We're even pulling it downwards for a little bit. And unfortunately, we don't have such big data in Jordan. But I believe we're going to have other high rates of cancer, maybe breast, and I bet colorectal cancer is also of high prevalence among the early
Yeah, and they recently made the cutoff age for screening for colorectal cancer from 45 to 40, right? So it's 40.
I don't know about the 40, but I know it's 45 right now
Oh, okay.
because it was 50
I
years
heard,
ago.
yeah, I heard that there are, I don't know if they did or didn't, but I heard some
They want to. They might change it, yeah. So like the take home message is that regardless of how simple the symptom might be, it can be much worse than that. Regarding not just to bleeding, let's say a breast mass. I know a family member of a very close to me. She was 20 something and she had a breast mass and they were like, oh, it's fibroadenoma. And then once she had back pain and it was a compression fracture, like a pathologic fracture, they found out stage 4 breast cancer. Because she was too young to have cancer. So we don't have something called too young, especially these times, because early onset cancers are on the rise. That's my take home lesson.
Narges, and this is where the importance of taking good history comes. Like, imagine if you didn't ask about the weight loss, if you didn't ask him how he's doing, for example, he didn't mention about the weight, we wouldn't have thought about that, And I know because medicine is more leaning towards technologies and labs and images, people forget the importance of actually asking the patients. One doctor once told me, the patient will tell you the diagnosis. You just need to ask. Just need to ask, and they will tell you the diagnosis. Even if you don't tell you the diagnosis, they will tell you certain things that will help you, let's say, actually look for a different diagnosis, like what happened with you.
Correct. And sometimes we have that bias that, okay, he came into a hemorrhoid clinic. So he has hemorrhoid. He was pre-screened and he has hemorrhoid. That's it.
Yeah.
So we never actually think about something else. We never broaden our questions and ask, what are you doing? What's going on with you?
Yeah.
And newer patients just don't say it. Like he didn't think it was relevant to say in a medical history. He just thought it was distress.
That's a really interesting case, honestly. And I have a similar case related to taking history. And that happened also when I was doing my elective rotation. So basically I was in the cardiology service and I remember a patient coming to us after a car accident. She was in her late 20s, 27, 28. And she said she passed out and she hit a tree. So that's basically what happened. Thank God, actually, she didn't have she had minor bruises and stuff. She was okay. However, something significant happened for her to pass out while she was driving. So we put her on continuous telemetry, which is basically continuous ECG monitoring to monitor her heartbeats. And we noticed intermittent high degree heart block. And that was weird for someone who's as Narges said, she's young, she's 27, 28. Why would she have a high degree heart block? And so we started, I remember they started doing some tests and stuff. And I started asking, and she was in Florida, so she wasn't in an area when certain infections would be relevant, So I started asking her about recent travel, recent things that she has done. And she mentioned that she went hiking 2 months ago. And that was the first time that I see something like this. That was the first time. That's why I will never forget it, because in Jordan, we never see that, That was the first time I've ever seen something I studied in sketchy, So I remember when she said hiking, I was like, I remember it was me and the resident and the intern and the senior resident. We all looked at each other like that. And we were like, let's order Lyme serology. And then we ordered Lyme serology and it appeared that she had Lyme carditis. And once we started her on doxycycline, she was doing very well and she improved. And that shows the importance of history taking, as Narges said. And imagine if we didn't ask her, because the patient thinks it's irrelevant. She had a car accident. Why should she tell us that she went hiking 2 months ago? But that's the importance of, asking the patient, have you done something different recently? Have you done, something that changed your routine or something? And if we didn't ask her that, we wouldn't have known that. And Lyme carditis, if you don't treat it, it can progress to something worse. So I'm really happy I have witnessed that for the first time in my life. And it was a great teaching experience for me.
It also sheds a light on the anchor bias that sometimes doctors have.
Yes.
We have something in our mind, he has this, but sometimes it can be a lot bigger.
Yeah, sometimes it's an ego issue. Sometimes doctors don't want to be wrong. I know she has this and she can't have something else,
And sometimes we don't want to seem stupid. Whenever we were at rounds at the university and the doctors ask for the differential and we say cancer, people are like, oh, cancer, oh, what the heck, cancer? So we're like, no, we're not gonna put it right now in our differential. We're gonna wait for like more red flags in our history taking. But sometimes it's just like it's right there. You're just gonna ask for it.
Yeah, it's so true.
Yeah, it honestly goes to show you how important it is to ask the right questions, to listen to your patient. You know, you might be asking all the great questions, but it's really, really important to listen to what they're saying because it can totally change the diagnosis and shed light on something that you might have not seen or something you don't want to see because, as we said, your ego. So yeah, thank you so much for all that input. Those are very, very important cases, and I think that they really shed light on a certain aspect that more medical students should like adopt in their own lives.
All right. So for our fun question for this segment, we're gonna ask, never have I ever used studying as an excuse not to go out and still didn't study.
That's actually my favorite part of medicine. Yeah, that's why I'm tolerating being a doctor because it saves me from so many occasions.
Honestly, yeah. It's allowing the time.
Yeah.
If it was a valid excuse, no one can tell you, oh wait, are you sure? Like you can skip this time.
Yeah.
Yeah. And I feel like it really saves you from all these extended family weddings. You know what I mean? Like my aunt's cousin, my mom's cousin, my I don't know what. I have studying. I really can't go. I have an exam.
Yeah.
It really works. Yeah. Okay, so now going on to the third segment for today, student Q&As. These are questions that we have collected from students that have inquiries about the match process.
So for our first question, it's gonna be very, very general. What is matching?
Okay, so matching. So in simple terms, basically it's a system that pairs applicants with programs. So you apply for you apply for a residency in the US to a certain number of hospitals and programs. You get interviews and you have those interviews. Then comes a time called the ranking. So basically you as an applicant, let's say you receive 10 interviews. So you rank those programs from 1 to 10. And also the hospital, let's say they interview 100 applicants. They will rank those applicants from 1 to 100, okay? Now, what is the match? Is basically there's a system, an algorithm that on match day matches your rank list as an applicant with the program's rank list. And then they will match you with the program that you want, that you have ranked highly on your list, and they also want you. So this is basically that's why it's called matching, because you know it's like two rank lists and they pair you together.
Yes. Okay, now for our second question, what are some critical mistakes that applicants make during the match application process and how can they avoid them?
One of the biggest problems that students face these days, and they don't know about it, is that they don't read about the programs. They apply to programs that do not fit them. And the solution to that is either ask, the questions are for free. Just ask and you're gonna get an answer. Or if you don't want to ask anybody, just read about the program. See if they sponsor visas, for example. See if they look at their match list. See if they take international graduates, for example. If you looked at a program, for example, and you saw that they never took an international graduate, it wouldn't be smart of you to apply to that program and waste your money unless you know somebody there who's going to strongly recommend you.
And also another mistake I see many people do is because now we have ChatGPT, it is okay to use ChatGPT to help you. You know, you can like write something and let them like polish it, but you know, it's your idea, okay? But the problem with what happens is that I saw many people have this problem that happened with them is that they make ChatGPT write their application from scratch, and it's like written by someone who is like mother tongue and mother language is English. And then when the interview comes in, especially in your personal statement should be written in simple words if your mother language is not English, like us, for example, okay? And then, you know, ChatGPT writes very sophisticated words. So they put it in their personal statement. And then when the interview comes, you get many interviews because of your application. And then when the interview comes in, which is the most important part of the process, they can't even complete one sentence. So the program directors will know that you did not write your application. I know a person, for example, many amazing credentials. He does not speak English very well. He got like 10 plus interviews and he did not match. This is for the second year. And this is because please don't use sophisticated words in your application if you cannot say these words in your interview, because it will show. People will know that this is not you. So please write your application in, let's say, a humble way that describes you. They don't care about a perfect application. They care about a really genuine one that shows personality.
Yes. Speaking of interviews, I was once getting the advice to prepare but not prepare for the interview.
Yes.
If you sit in the interview and you memorize some answers like you've printed on a piece of paper, you're gonna sound robotic. So you're gonna look at they're not gonna rank you. I guarantee that. So as long as you sound genuine, just like Farah said, is the most important part of the interview.
Honestly, that's great advice. For our third question, can you speak about the role of networking during the match process? How can candidates use their connections in a meaningful way without coming off as like opportunistic, or you're trying to take advantage of your supervisor?
I'm gonna say it's okay to be opportunistic. At the end, that's the only opportunity. If that's the only opportunity that you have, take advantage of it. That's the first of all. And second of all, networking is the most important part of matching, in my opinion. I got all of my interviews through networking. I matched because of networking. I even got my elective rotation from networking. So networking is key to matching, especially in a competitive specialty like general surgery.
Yeah.
And I would say that once you connect with a doctor or something, for holidays, email them and say Merry Christmas, Happy Easter, as a way of just like making them remember that, oh, I know this person. Also ask them if there's like any research project that they might need help with. They're going to say no, but they're going to see it as a nice gesture. Okay, he wants to work. He's a committed student. He's actually good. It's okay to joke with them but like keeping it professional. That's like another advice that I thought was very helpful.
As Narges said, networking is very important. However, I want to say, please do it correctly and smartly. So, for example, who's your connection? Someone you know on social media, you have on Instagram, she's a resident in the US because just you're Jordanian and she's Jordanian, this is not a connection.
Yeah, I don't think, that's not called networking.
Click and find
Let's working first.
Exactly. Know, please, how to make connections. For example, I remember when I was applying like in September, my friends used to say, oh, I have a connection in this program. I was like, oh, do you know, like, did you work with them? They were like, oh, I have her on Instagram. I was like, okay. And for me, I never asked someone I didn't work with. They all, like, I asked someone, oh, hey, I'm applying this year. Can you please like help me with this, with that, with the letter, or with like, reaching out for me or pushing for me? And people, all of them were either someone I did research with, someone who saw me work in clinical practice, someone who, worked with me in med school. So you need to have the correct connections. This is number one. Number two, even if you don't have family in the US, I am first generation doctor. I don't have even no one doctor in the US. No one. I didn't have any connection. Don't be too desperate and don't be too hopeless. Like, oh, I don't have connections. I'm not gonna match. No, take charge of your own life. Don't please. I hate the victim part in the life. It's like, oh, I didn't match because all of these people have connections and you don't have connections. I hate that. So what you should do is you should make your own connections. When I went to the US, I made connections at the conference. I made connections in my elective rotation. And, connections. This is number one. Number two, even if you don't have family in the US, I am first generation doctor. I don't have even no one doctor in the US. No one. I didn't have any connection. Don't be too desperate and don't be too hopeless. Like, oh, I don't have connections. I'm not going to match. No. Take charge of your own life. Don't please. I hate the victim part in the life. It's like, oh, I didn't match because all of these people have connections and you don't have connections. I hate that. So what you should do is you should make your own connections. When I went to the US, I made connections at the conference. I made connections in my elective rotation. And, these things worked because clearly I matched there. So make your own connections by being always on time, by being proactive, by, as Neb just said, always emailing them and reminding them of you, being professional, but being also nice and being a team player. All these things are very important. And, even if you have a connection, like let's say your father is the program director, not your father, or like someone, from your family, but you don't do well at interviews, your credentials are very bad, you're not going to match. And even if you match, they will regret their decision that they matched you, So you need, connections are important, but you need to also have a little bit of capabilities, For example, let's say Narges, she matched in surgery. Okay, connections are important, but she was working as a postdoc fellow. She worked at the same place she matched at. She was not sitting in Jordan. She was like, oh, I hope I match because I have connections. So I don't like the idea of like, oh, I have connections. I should like just trust and not do anything and I will match. That's not how it works.
Yeah, I probably should have shed more light on what connections mean, in my opinion. For example, one of the interviews that I got, I met a surgeon at one of the conferences, and she liked my work, and she asked my boss, "Who is she? Is she a resident or something?" And I said, "Can I email you? And you're a program director of general surgery somewhere. Can I get an interview?" And she said, "Sure, apply to our program." And I applied to their program in October. Like, it was even after the matching. I paid for that program and I applied for them, and they gave me an interview. Although it did not sponsor visas, it never took IMGs, and she gave me an interview just because I met her and I made connections with her.
Exactly.
And saying how my connections help me, I never told anybody of my, like, from my close family that I applied for the match, because I had like a 50-50% chance that I'm not gonna match. And only my sister knew, my dad and my mom. Uncles, aunts, cousins, nobody knew. None of my friends even knew. Like, my friends called me قنبلة الموسم when I announced that I matched, because I never told anybody, because, like I said, it's just a stressful thing, and I never knew that my connections were gonna work that good. But when I did my elective, I saw an interesting actually, it's the story of me getting my spot as a postdoctoral research fellow. Was when I got kicked out of one of the OR rooms. It was like there was like a bleeding for some patient. The doctor was stressed. He was like, "I don't want students, get out." And it was my first day in the States. And I was like, "I hate this place. I want to leave." And I was just like roaming around the hallway, not knowing where to go. And one surgeon saw me. He's like, "What service are you on?" I'm like, "I'm an international student and I don't know where to go. I'm in colorectal." He's like, "Well, there's a combined case with urology. You want to come?" I was like, "Okay, I'll come." And I saw this patient. It's a very interesting case. And I was like, "That's amazing." He's like, "You want to scrub in?" I'm like, "Yeah."
Wow.
I scrubbed in for this case. And he said, "We're planning on doing a case report. You want to participate?" And I was like, "Yes." I told my boss I saw this amazing case in urology, and it has like some aspect of colorectal surgery in it. Can I present it as a case? And he's like, "Yeah, if you want to." I presented as a case, and the chief of the division at that time, he was like, "Well, are you interested in doing research with us next year?"
Wow.
I was like, "Hell yeah, let's do it." But he said, "Listen, we can only afford 2 research fellows, and if one of them does not match next year, you're not gonna come." So I'm like, "Well, okay."
I hope they match. They match, and I'm here, so go figure.
So that's the main importance of connections. Like, go there, know people, talk. Like, even if Farah said in the beginning of the interviews, if you see an opportunity, take it.
Yes.
Because if I never talked to that guy and I was pissed off, I don't want to talk to him, I just want to go home, I would have never been here. I would have never known what I've been doing right now.
See, guys, always say yes. Always say yes to opportunities. You never know what's going to happen.
Even if you got kicked out right before it, just do it. And actually, I've never spoken English in my life before that day. It was just law and Quran and medicine. So my English was like, no, I don't. Here we go. It just all went well at the end.
Yeah. Okay, so thank you so much for those answers. Question number 4. How does the match algorithm really work? And are there things that applicants misunderstand about how their rank list influence their chances?
So I will say something about this, and something very important. People, applicants usually miss and try to like trick the system. So the match algorithm works in favor of the applicant, not the programs. What does that mean? Some applicants, let's say I got, for example, 11 interviews, okay? So you should rank the interviews and rank the programs based on your true preference, like based on where you really want to go. Like if, for example, program number 1 is the place that you really want to go, you put it as number 1. Not like based on how well you did in the interviews. So for example, some people, what do they do basically? Oh, so this program, I don't like them that much, but they liked me really well in the interview. So they will write me high. I should rank them high. Don't do that. Because first of all, you can never know how well your interview went. Some program directors are just nice. So they will be nice to everyone, and they will give you the feeling that they want you, but actually they will not rank you high. So this is a game you should not play. You should not just try to guess where people rank you. You should solely rank based on your true preference, because the match algorithm will say, oh, let's say Dr. Farah ranked 11 programs. Okay, let's look at the program number 1. Did program number 1 rank her high enough for her to match? If yes, you match there. They don't do the opposite. They don't go, okay, let's say University of Florida. What is the first applicant? No, they go to the applicant, you know? That's how it works. So basically, please rank based on your true preference. Do not try to trick the system and rank, based on how they liked you or not. If you, for example, if you rank a program number 1 just because they liked you and you don't like them, you'll end up there, and that's a bad thing for you. If you matched, you're stuck there. So please take this advice. What do you think, Dr. Narges?
100%. Think of it like القبول الموحد for تخصص الجامعات. You don't rank الجامعة الأردنية جامعة تكنو then مؤتة then البلقاء. No, you just do it not because where like the chances is higher. No, based on what you want, and then they're gonna favor you, not the program.
Honestly, that's a really great advice, and it's a new way to look at the program. Like, I would have thought, no, you should rank based on how much you would be accepted into there, but obviously you should go by your own preference. So for our 5th question, we want to know, what advice would you give to someone who is applying to a highly competitive specialty, for example, surgery, dermatology, in terms of managing expectations and strategies? I think Dr. Narges, you should start.
First of all, strong credentials. Like, you gotta have high scores. Because of, let's say you have connections, the person who is recommending you has to have something on paper so he can go and say, look, I have a strong applicant, I want to recommend. Second of all, you gotta do research, preferably in the States. Elective rotations is also very important. Like, you gotta go there, because why are IMGs not preferred like American graduates? Let's say you're a program director at an American institution. Would you take your graduates, or you would go to Jordan, Palestine, Syria, and take people that you didn't even train? You would take only your graduates, and some spaces are left. You take the internationals. You fill them up with the strongest applicant from an international institution. So I would say the most important thing for a student is having a hands-on elective rotation. Because if you get letters from the United States saying, oh, this person worked with us and he did just as good as an American student, although he's an international graduate, they would give you a shot. Letters are very important. Research is very important. And if you look at the papers that you, like, not the papers, sorry, if you look at like online and see how many papers you need to have, it's not about just publications. Let's say abstracts, poster presentations, anything regarding research, even if it was very small, just add it on your CV. They're not going to laugh about it. They're just going to count it, say, oh, there's a total of 17. We're going to give him an interview. Some applicants from my university, very excellent scores, very excellent people. They work, let's say now at KHCC for like a transitional year, and they applied for the match. Although they got like 70s in their step 2 scores, they only added 1 ongoing research publication as their application. They never got a single interview. Research is important. Sort of like sum it up. Research, letters of recommendations through hands-on elective rotations, and what else did I say?
Credentials. Yeah, connections, yeah.
And if I can ask, how would you say they could manage their expectations for such high competitive specialties?
Lower your expectations. It's very difficult. Look at how many people matched in your country who were in your same shoes. How many did they match in dermatology? How many matched in surgery? Compared to, let's say, internal medicine, compared to, let's say, family medicine, peds. And see what are your chances. Like, do simple math,
Sure.
Yeah.
Okay, this is the end of the general match process questions. Now we would like to give you guys a very quick, fun question. Would you rather get through a long shift without coffee or without your phone?
My phone. No, my coffee. Sorry, I didn't understand the question.
Yeah.
No, coffee, because I don't drink coffee, so I don't care.
Dr. Narges?
Coffee, definitely.
You're giving up coffee? Okay. Honestly, I think
If we give up coffee, can we drink Red Bull or something like an energy drink?
Yeah.
Or like caffeine?
That works. Yeah, I think that's okay.
You were saying we are what we eat.
yeah.
Yeah.
We are what we eat.
Okay. So now for our second segment, ECFMG and IRAS applications. So first of all, what is ECFMG and what is the IRAS application?
So ECFMG, it's like an abbreviation for I think the Educational Commission for foreign graduates or something like that, you know. So it is something for international medical graduates, people who did not study in the US. You know, US students don't know about it. So it's basically like your US med school. It's the place that is responsible for you to make sure that you are eligible to practice in the US and to apply for a residency in the US. So it's the place through which you apply for step 1, step 2, through which you get we call it ECFMG certified. So after you finish step 1 and step 2 and OET, you apply for something called ECFMG certificate. Once you have the certificate, you can then practice in residency in the US and apply for residency in the US. So it's like, you know, like the Ministry of Health here, but just like that in the US, something similar to that. And you also asked about the ERAS.
Yes, please. Yeah.
Do you want to talk
It's the
about it?
application that you fill up when you want to apply for the match. That's like in simple words.
Yeah, it's like your match CVs.
Yeah. Specific headlines that you need to fill. But it's just like a regular CV that you need to fill before the match.
All right. With the rise of virtual interviews and online applications, what aspects of ERAS applications do you think the applicants tend to neglect that might hurt their chances?
I think applicants neglect the things that are not medical. Let's say, for example, there's a section in the ERAS application about meaningful experiences and about impactful experiences, and there's a section about hobbies. These things, I think most of my interviewers ask me about them, you know, because when interviews are virtual, you know, they don't get to see your vibe, and you know, we don't meet in person, so they don't know if you are actually a fun person to work with. You know, if they called you for an interview, if they sent you an interview, they already like your medical stuff. They already like your, let's say, credentials, your scores, your research, but they want to get to know you in the interview as a person. So I think in the US application, you should give them something to ask about. Like in the hobbies, please don't try something generic like, oh, I love reading and swimming. Okay, it's okay if you love that, but like, please be more specific. For example, you know, sometimes people think hobbies should be something very big, but it can be something as simple as, for example, I like photography. So I wrote photography. Many people ask me about it, and I just use my phone, you know. I'm not like a professional photographer. You know, I wrote fashion design. I like fashion, for example. I had someone who likes Saab and we started talking about dresses and stuff. So, you know, this could be a conversational opener, and you should not neglect this part. And also the impactful experiences. You should write why this experience has been impactful, because it will help them know you as a person, not just as a doctor.
Yes, I definitely agree with what Farah said. Sometimes you don't even include these things in your interview. You don't think they're important. One interview that the doctor was telling me, tell me about yourself, the basic question that everybody asks at the beginning. And I started saying, my name is Nar. And then he's like, no, I got your CV next to me. I know your name. I know your scores. I know where you graduated. I know where you did your elective rotations. I know everything about you. I want to know, who are you outside of medicine? What do you do? What do you do in your free time? What's something that you like to do on a long weekend with no work on your hands? So they want to know these things, because they're not hiring a machine. They're hiring a person who's going to work with them for many years forward. They want to know who you truly are.
Exactly.
Okay, and now for our 9th question. What are the subtle but crucial components of an application that applicants should focus on in ERAS to maximize their chances of matching? For example, should one focus more on showcasing research or clinical work?
Everything.
Yeah, a little bit of everything.
Anything is more important than the other, honestly. However, for example, if you just want to match, and you want to match it, for example, at a community hospital, they don't care about research. Actually, if you have too many research, they will not rank you high because they don't want someone to tell them, oh, I want to do research. They just want you to work. However, if you're someone who wants to match at an academic institution, at an institution with research, you want to do fellowship, you need to focus on research, you need to focus on clinical experiences, you need to focus on volunteer experiences. I think they really look they tell us that, and they usually look at it this way. They look at applications holistically. You need to have a bit of everything. Nothing is more important than the other one, honestly. So I think it is very important for you to have a bit of everything.
Like even if you got in the like you passed step 1 and you had 241, let's say, in step 2, it's not the end of the world because the application is a big thing, and you can just work on the other aspects of the interview. You can get more interviews than somebody who got in their 60s and 70s.
Yeah, you should work on what your strong suits are. For example, fill up on research or something. Yeah. Okay, so for our 10th question, how can applicants ensure that their letters of recommendation truly reflect their potential, especially if they don't have a close relationship with their letter writers?
I just want to say that you should be clear from your first day about wanting a letter of recommendation. You know, if you don't want to tell them, for example, if you do a clinical rotation or you do a research like Narges did, if you don't want to tell them from the first day, it's okay. But like once you have known them for like 1 or 2 weeks and you have really left a good impression, tell them, oh, I'm planning to apply next year. I would really appreciate if you can write me. You don't tell them write me a letter of recommendation. I want you to write me a strong letter of recommendation. You know, Americans are straightforward. If they don't know you, I remember for me personally, when I did my elective, I met many physicians. There was a doctor that I met for 1 week, and at the end of that week, I told him like, would you be one of my letter writers? Like, if you want to write me a strong letter. He apologized. He was like, I've only worked with you for 1 week. I'm sorry, I can't write you a very personalized letter. And I really respected that. It's totally fine. But, I worked with other doctors for like 3 or 4 weeks. And I remember asking them, they were like, yeah, we would be so happy. But you should help your letter writers. How? When I asked them 1 year later for my letters of recommendation, I sent them a PDF with, number 1, all the cases I saw. I used, when you're doing elective rotation, write the cases that you see. So the cases that I presented, any research I did with them, any interesting discussions that we did. If they wanted me to present a topic, I presented this topic 1, 2, 3. Any special encounters that will help them write something specific about me. So that's what I did. And the letters are waived, so I don't know what they wrote about me, but I remember in one of the interviews, the interviewer told me, she was a very well-esteemed physician. She said, I believe when something good is said about someone, they deserve to hear it. And then she started reading my letter of recommendation. And the doctors mentioned how I interacted with nurses, how I presented the patients. And then at the end, the doctor said, I don't know which one of them, I had like 4 letters, so I don't know which letter was that. And he said, Farah is one of the top 1% students I've ever worked with in my life. So, you should be very eager to leave this impression. You should be the nerd student in your rotation. You should be proactive, not to take the roles of other people, but you should be proactive. You should ask questions. You should tell them, please, I want to present this case. Ask them for research opportunities, as Narges said. And so this is an important thing. Help them write your letter, send them your CV. Send them sometimes if you have it with your personal statement, and send them a PDF of all the things you did together so that you have a very well written, specific letter of recommendation.
Yes, 100%. Let's say if you don't have a personal connection with the doctor, don't even ask for a letter of recommendation, because a generic one is worse than not even having one, in my opinion. Because once they see I know a doctor in the States, when students ask him for, he offers everybody letters of recommendation, especially international ones. They would email him and ask for a letter of recommendation. It was a form generated through ChatGPT. So I wouldn't really want such a letter of recommendation. So if you worked with that doctor, follow him, make an impression, be actually a good student. And I want to give you something that actually happened with me when I did my rotation here. I found out at the end of my rotation that one of my classmates did the same rotation just a month before me. And he was the worst. He just came here for vacation and never really wanted to work. And there's a huge difference between you and him. And for my university, when they send students to UIC, they're usually the top students. So this top student failed to even get a good letter from them because he just he saw it as an opportunity to have fun in the States, not actually work. You came here, you paid your dad's money to get an elective rotation, get the best of it, you know?
And I want to say something. Be smart about letters. How? Even if you have like 1 month rotation, like not 2 months, from 1 month you can have 3 or 4 letters. You know how? For example, in the US, something was really nice that they have multidisciplinary teams. So I was in my first 2 weeks, I was in the CCU. In the CCU, we had a palm crit attending, which was the attending that I was rotating with. We also had a cardiologist. So I took a letter of recommendation from my palm crit attending and also from the cardiologist because I presented the cases in front of him too. And also, I took a letter from another palm crit that I rotated on the weekends. He was on shift, so I used to go on the weekends. I didn't have my weekends off because I wanted to like maximize my potential. So I went on the weekends and I worked with him like Sunday, Saturday of 2 weeks. It was like 54 days, and we had many amazing discussions. And he also wrote me a very specific letter. So in 1 month, you can get many letters. Don't underestimate the power of presenting in front of a whole team. Many of those team members, if they're attending, they can write you letters.
Now, Dr. Narges, you said that some doctors will be giving us generic letters of recommendations. How can we know beforehand? Because as Dr. Farah said, we will not be able to see our letters of recommendation. How do we know who to ask, or how do we know if they're going to give us a personal one or just a generic one?
If you worked with them, they're going to give you a personal one if you asked for it.
Okay.
Because they're honest. They're going to tell you, no, I'm not going to write you a personal one.
Yeah.
They're very straightforward. If you didn't work with them, 100%, I guarantee you it's going to be a generic one.
Okay, 1000%.
Okay, so Dr. Farah, what are the different types of visas?
So the most common types of visas that applicants go to the US through are J1 and H1B visas. So basically, J1 is more common, like many programs sponsor J1. J1 is sponsored not through the program, but through ACFMG itself. So it's easier for hospitals to sponsor you through J1. The problem with J1 is that in order to get the green card, you need to either go back to your country for 2 years or do a waiver, which is like work at an underserved area in order to get the green card, which is like after I think the duration of it is 7 years. However, the H1B visa, first of all, the problem is that not many programs sponsor the H1B visa because it's called employer sponsored. So it's not sponsored through DCFMG. It is sponsored through the program itself. So it costs the program money-wise more and more paperwork because it's sponsored through themselves. And also it needs step 3. So you need to have step 3 to get the H1B visa. This is number 2. And number 3, when you do fellowship, not many fellowship programs will sponsor H1B. So you will limit your options doing H1B. However, if you go to a program with H1B that already has in-house fellowship, so they have fellowship in the same hospital, you can go to that fellowship in that same hospital. But the good thing about the H1B that people really like is that you don't have to do the waiver and you don't have to go back to your country. You can get the green card easier than the J1 visa. So those are the 2 differences between J1 and H1B visas.
Okay, so now moving on to our next segment, post-match insights. If you guys could give us a brief description of what is SOAP or soaping, as you guys have mentioned before earlier.
It's a supplemental offer for students who did not match. So if, let's say, our match day was March 17th, if I saw that I did not match, I will apply for the SOAP. And during this 4-day period, the programs who also had openings and had like unmatched positions, they would send offers for those students who did not match. It's very difficult for internal medicine to take somebody during SOAP because they usually fill in all their spots. But it is a common way to match in surgery because they have preliminary positions, and preliminary positions, only 50% of them fill during the match day. And the other 50% are filled during SOAP. For example, my institution, they filled 4 during match day and 4 during SOAP.
Wow.
So if you didn't match in surgery, you still have a 50% chance of matching again during SOAPing. Don't worry about that.
Looking back at your own match experience, were there any moments or decisions that you made that in hindsight you would have approached differently?
Many, actually. when you go into the math process, even if you are prepared, even if you're not a first generation, even if you have a bigger brother or sister or someone, you are going to make your own mistakes. Let's hope they're not fatal mistakes, but you're going to make your own mistakes. In terms of different ways to approach this, I think, I would take this process the same with all of its mistakes because I learned a lot. But I would make things, easier for myself. I would have done, let's say, step 2 earlier, prepared for the ERAS application earlier because like the papers got delayed. So I got, for example, my MSPE the night before the deadline. So to avoid this stress, to have all your papers early on, I think I would have, as I said earlier in my match dilemmas, is that I would change the way that the number of programs that I applied to, I would limit them because most of the interviews are currently coming from signals. So I think those are the things that I would change.
I would change which programs I applied to, and I would also take step 2 earlier, like Farah said. I took it August 31st, so it was like very delayed. And my score was delayed, my letters were delayed, everything was delayed. I was like, I'm not gonna match. And I would also prioritize getting a high score because it was really important for me. I lost a lot of interviews because they apologized for not being not scoring as high, as the other international graduates. Because usually international graduates are very competitive. They all score in the 70s. I was like, no. They're like, no, we have like other stronger scores, so we would rather take somebody with a higher score,
So now for our last question, what's one thing you wish every applicant knew about the match process, especially considering the growing number of medical graduates applying every single year?
Believe in yourself. There are so many applicants. They're going to be maybe like 1,000 more every year. It's totally fine. You have a position that is written for you. You just work hard and don't compare yourself. Work hard. You have your own journey, your own pathway. Maybe in the same med school class, some people will apply 3 years earlier than you because they had things ready. You have your own circumstances. You have your own pathway. You can apply 2 years late and match at your dream program. So don't be too hard on yourself and don't compare yourself and don't even think about the idea that there are too many people applying. If you work hard enough and you do all the things that are required from you, then you will go to the place that is meant for you.
I would say pursue your dreams too. Like, even if it's going to take you longer times than the usual, what's a year? What's a 2-year difference? What's a 3-year difference? If you look at it like from a broader perspective, what's a 5-year difference? We're already younger than all American graduates. I'm going to be the youngest intern, and I've already wasted 2 years of research. So if I want to look at it, I wasted 2 years. Actually, I didn't. I'm already ahead of my time, and there's no such thing as a specific timeline. Just do what you want to do. Even if you had to, let's say, work an extra job for the expenses, do it because at the end it's worth it. It's your future. If you work hard for it, it's going to feel better when you have it,
Thank you so much for your insightful opinions and all your experience. We really, really, really appreciate it.
Thank you for Dr. Narges, and thank you, Dr. Farah, so much for being here with us today. It has been truly an insightful episode. Thank you for everyone tuning in. We hope you learned a thing or two.
Bye-bye.
Bye.
A big thank you to Dr. Narges and Dr. Farah for joining us today and sharing their insights. It was a pleasure having you both on the podcast, and thank you for tuning in.
If you found this episode helpful, make sure to follow and share it with a friend. Until next time, keep learning, stay curious, and take care.
I think